Yeah, sure. So I guess we start on a Monday. Every day starts at about 8:30. We come in and do a round with AJ. We see all the inpatients, and then generally that takes about half an hour to an hour. And then depending upon what's happening for the day, we sort of divide and conquer. So there's two of us here. So one of us goes across to the emergency department and sits in with a triage nurse for the morning and sees all the emergency presentations, whereas the other person comes across to the practice and parallel consults for the morning. And then generally in the afternoons, we normally study or we have our tutorials that are scheduled. Yeah, so there's a range of visiting specialists that come out to Ceduna. We're quite lucky in that regard. We have a lot of exposure. We have Mr. Bruning, who comes as a general surgeon once a month. We have Mr. Facina, who comes in and does orthopaedics once a month. And then we have various physicians that come. We have a cardiologist, rheumatologist, renal physicians. And so, yeah, generally it's once a week we have someone here. And so I guess that's the third stream of what we get to do. It's either the ED or the parallel consulting or sitting in with the visiting specialist.
Well, they can come and assist. So usually one assists me, and that means they get opportunity to stitch and suture, and occasionally, depending on what the type of operation is, they can actually, help do it. So that's a great experience for them. And usually because they're here in Ceduna, one person can help me and one person can help the anaesthetist up the other end of the table. So it really is the whole immersive process, if you like. So they've got lots of opportunities up here.
So the mixture of cases that we see is typical representation of big community. We see everything there, and the cardiac problems, the aged care, older people, the pediatric cases, the obstetric, gynae. It represents the broad spectrum of medicine. It's not just one selected small number of cases. I think it's partly because there are a lot of travelers and migrant population, plus the indigenous community. A lot of people, they're also migrating population. So this is why you see such a variety.
We set us up with Yadu Health Aboriginal Corporation, which is a small GP practice which specifically looks after the Indigenous community in Ceduna. And so at various times throughout the year, we have a few days with them, get attached to their doctor, Dr. Pangula, and also any visiting specialists that they have. They run small outreach clinics out to Yalata and Kuniba and places like that, Scott Desco as well. And so we jump on the bus with them and, we go out and do the HbA1c checks and do all the 715 type of checks that get done. And it's been a really good exposure, I think, to Indigenous health. Especially out here, it's really opened up our eyes.
I think it's a bit of a lifeline for our community members to see some young, inspiring doctors come to Ceduna that may have an interest in rural placements in the future.
Just the community itself is fantastic, very engaging, very warm and friendly. It's easy to live here, it's easy to work here, and the environment itself is fantastic. Like, we've got beautiful beaches, and I couldn't recommend it highly enough. It's a great place to come and do some time and hopefully stay.
Yeah, it's been good. Pretty unexpected. I thought it was, I guess I wasn't know what I was expecting living here. That's, really exceeded expectations. It's a really quiet seaside town where we are situated. It's within walking distance of everything. So just walk to the shops and walk to the hospital and to the pub for dinner and that kind of thing, if you're into that. Probably about 3 weeks ago, Andrew Lane, who's the Director of Nursing here, took me out fishing on his boat. We went and caught some Samson fish, which I don't know if anyone listening knows what they are, but they get quite big and it was good fun to catch. So yeah, if you come up here, you need to ask Andrew to be his deckhand for the day and he'll definitely take you up on that and take you out.
I think the highlights is just the social interaction with staff when they're not at work and the community members in general. Going fishing with the boss and going four-wheel driving with Dr. AJ and AJ cooking the meals and them getting to know other people in our community.
Yeah, 100%. It's definitely been one of the best years of placement I've had. And just the fact that you'll get to do so much hands-on work instead of being like second, third in line to see the patient, you're there basically right away.
Didn't really have any expectations coming out here, but it's blown me away. The experience I've had this year has definitely been my best year of placement to date, and I'd highly recommend everyone to come out here and take the bull by the horns and really experience it a lot and become quite a proficient medical student and have a really good year as well.
I think for the medical students that come to Ceduna, they get exposure to a lot more variety of things that happen in a small rural town. So we're pretty lucky that they can have that exposure with all the visiting specialists and get to do theatre. They're called in for accidents if they want to be. They're called in for mid-rounds if they get a rapport with the patients. And it's general consistency, I think, for the whole 12 months they're here.
You get the first-hand information. You can hear about the patient journey. You can see someone in Royal Adelaide Hospital and they will give you a beautiful history about this happened, this is how patient presented. But be there, see it, first-hand information, then you remember. You're not going backwards and asking what happened and trying to create a picture. I think go rural to see it and get that first-hand experience. I think that's good for students.
You know, it's just the intangible things that you get experience with, you know, sticking around in the emergency department late at night and seeing things that most people don't see. And plus you don't have that buffer of registrars and residents and interns between you and the patient. So there's a lot of great opportunities up here.